giving your baby a sound beginning. Have you ever wondered, how soon will your baby learn to communicate? Even before birth, a baby hears the rhythms and tones of sounds from the outside world. Newborns are especially sensitive to the sound of the human voice. As this baby watches his mother's face and hears her speak and sing, he is already learning to communicate. His hearing system and brain are being shaped every day by the words and sounds around him. A baby's ability to communicate and bond with caregivers develops rapidly during the first months and years of life. By about 3 months of age, most babies will smile when spoken to, and by 6 months they will begin to babble and imitate simple sounds. And by 1 year, most will say their very first words. How does your baby hear sound? As this mother's voice reaches her baby's ear, the incoming sound causes the eardrum to vibrate, which then moves 3 small bones in the middle ear. This movement stimulates thousands of tiny sensitive hair cells in the inner ear. From the inner ear, the sound signal is carried along special nerves to the hearing centers of the brain, and the baby experiences the sensation we call sound. How can your baby's hearing be checked? Thanks to advances in technology, we can now check a baby's hearing shortly after birth. Your healthcare staff is concerned about your newborn's hearing because 1 out of every 300 babies is born with a hearing loss. Children who cannot hear clearly will often have trouble learning to communicate. That's why it is important to check or screen each newborn's hearing using one of 2 safe, simple, and painless procedures. Let's watch an example of each. One method is called OAE, or otoacoustic emissions screening. In this process, a trained screener places a small earphone in the baby's ear that emits a series of soft sounds. The inner ear typically responds to these sounds by producing echoes called otoacoustic emissions, which are analyzed by the screening equipment. Another method is called AABR, or Automated Auditory Brainstem Response Screening. In this process, a trained screener places Band-Aid-like sensors on the baby's head. As soft sounds are played into the baby's ear, these sensors analyze the brain's response to the sound. No matter which method is used, in a few minutes the screening is finished and the result is displayed. What do the hearing screening results mean? Most babies will pass the hearing screening before leaving the hospital, but some will be referred for further screening or testing. You and your baby's doctor will be contacted if you need to bring your baby back for more screening or for diagnostic tests performed by a hearing specialist called an audiologist. Most infants who need follow-up testing will pass. And if you are asked to return for follow-up, don't delay. Remember how important communication is to your newborn. You'll want to know if your baby can hear the words you speak and the songs you sing. After the hearing screening or testing is completed, talk with your healthcare provider about the results. Remember that passing the hearing screening is the first step to ongoing hearing health. Learn more about how a growing baby responds to sounds and enjoy watching your baby learn to communicate with you. What should you do if you have questions about hearing screening or about your child's hearing? You can start by reading about newborn hearing screening and getting ideas on how you can help your baby listen and learn. Check your information packet for brochures on hearing health or request information from your healthcare provider. Every child needs a medical home, a healthcare provider who works with you to care for your baby's overall health and development. If at any time you have questions about your baby's ability to hear or speak, don't hesitate to ask your doctor about referral for a hearing test. In fact, your baby's hearing should be screened at birth and again throughout childhood. Let's review the most important things you will want to remember. Remember that every newborn should be screened for hearing loss. Hearing screening is quick, safe, and painless. If more testing is needed, have it done right away. Finally, talk to your doctor about your baby's hearing and language development. We care about the health of your baby. Hearing screening is just one way your healthcare staff works together with you to make sure your baby has a sound beginning.